What do you make of the border going up? Is this a failure of the Victorian Government?
Look, thank you, Annalise. I think this is an incredibly important time for all of Australia as we look to Victoria. It is very clear there has been a breach in our defences against COVID. This is a very serious issue which could have devastating consequences if we don't move swiftly and act effectively.
What do you think is the key thing that's really gone wrong in Victoria?
Well, we know this has been set out by the National Cabinet, by the Federal Minister for Health, Greg Hunt, that the 4 important defences for Australia that we've been acting on for the last several weeks and months include effective quarantining, testing appropriately, tracing every single case, and appropriate physical distancing. And there is evidence that in Victoria, these things haven't been done effectively enough.
We've had a lot of discussion around these 9 towers being locked down. Some of them don't even have COVID cases yet. Is this a fair way to treat Australians?
Well, I think the people in those housing commission houses would be feeling quite shocked and devastated. I do believe that we need to act very efficiently and effectively to try and contain the COVID outbreak. I'm actually very interested to know what's been happening in the quarantining hotel situation, and I really do welcome the fact that Daniel Andrews has suggested or has asked for people coming in for quarantining to be moved to other jurisdictions. But I want to know what was the problem in the first instance so that we can make sure the problem doesn't happen in other jurisdictions. But getting back to those people in these towers, I'm hopeful that information is being given to them in a very timely manner. I mean, imagine suddenly being told within a number of hours you don't know where your next food is going to be delivered. Are you going to be able to access medication? What are the facilities and services being put in place to provide for these people? Now, there are a lot of people from culturally and linguistically diverse backgrounds. Has information been handed to them, not put in their post box, but handed to them at door knocking with translated information that's clear, that provides information about what's happening and what's going to happen in the future? Because we need to make sure that we have a swift and effective plan that brings people along on the journey and make sure that they get the services that they need. It must be terribly frightening for those people to suddenly be told there are people down, police down at the bottom of the stairs, and not to know necessarily what's going on. So I hope that the information is being provided in an appropriate way so that they can actually know what's going to happen in the future.
Would you like to see more response from the state government in communicating with communities in their own languages? As you said, that these are diverse communities and that's part of the multicultural fabric of Victoria. Peter Khalil was saying he used his own budget to be communicating with his electorate about the restrictions. Should we have seen more of this from the Victorian state government?
Well, what I can say is the federal government has made a significant commitment of $30 million and has been working very carefully across culturally and linguistically diverse communities right across Australia. There's been the Home Affairs Department has worked with more than 1,000 community groups, and particularly here in Victoria, the Minister for Immigration, Alan Tudge, has had 900 round tables with people from multicultural backgrounds and community leaders. So there's been a lot of work that's been done right across Australia. But what we need to do is partner that with specific information about what this lockdown in these towers means for individual residents. So you have to have both the macro and the micro, and I'd like to hear more direct communication to those residents so they know exactly what's happening to them.
Because it's a really practical issue here with these residents. It's not just the mental health implications or the stress of what they're experiencing, but we are seeing low levels of people taking tests, which is understandable when you've been locked in your apartment for an indefinite amount of time. If you test positive after that, you could be there for even longer. Should we be seeing better communication or even incentives payments to these people to get them to be taking tests?
Well, I would like to see a lot more manpower down there, making sure that they're interacting with the local community and explaining to them why there needs to be a test and what it means to keep them specifically safe. I mean, I've heard people saying, well, we need testing so that we can leave the towers. That's actually not the case. We've got to be very clear in our messaging. Saying that it's a lockdown for 5 days seems to be mixed messaging because quarantining is usually for 14 days. We know that if people have been in contact with someone who has COVID, they need to quarantine for 14 days. So the mixed messaging about tower lockdown for 5 days, I'm not even sure why it's been put at 5 days when we know that quarantining is usually a 14-day period. So I think there's a lot of mixed messaging going on at this point in time and a lot of confusion. So I'm hopeful that Victoria is going to respond. The Victorian State Government is going to respond by effectively messaging, making sure that they accept the help from the other state governments that are offering personnel that are trained and capable to come and support Victoria. The federal government has stood ready to offer support. The ADF has been offered over the last week or two. We know that there's been a problem that's brewing, and we need to make sure that the federal government is able to support the state government to deliver while it needs to do so in this crisis that's emerging here in Victoria.
And do you think it was the right call to shut the border between Victoria and New South Wales?
Well, I come from Albury-Wodonga, and I know how intimately those communities work across the border. And people flip back and across the Murray River between Albury and Wodonga. That's a natural part of living in those twin cities, and I know that's the same all along the border. So personally, I'm not so keen on border closures. I'm more interested in containment of cases. And if that means containing Melbourne, where all of the case outbreaks appears to be focused, I think that might have been better, though it may be difficult to actually enact that. But that being said, I do think that Victoria is the one with the problem, and containing the problem in Victoria is helpful for Australia until we get back control of this COVID pandemic here in Victoria. The breach of our defence is actually extremely serious. And it's extremely serious because in the past we've had a problem with outbreaks and resurgence. This is a problem of community transmission. This is the first time we've seen community transmission in large numbers. This is different than what happened previously. Previously, we were preventing or containing from international borders. We are now concerned about a community, broad community outbreaks here in Melbourne, and that is where the problem is. And therefore, I would be focusing on the Melbourne community rather than the Victorian community. People in regional Victoria which have no cases must be sort of scratching their head and saying, how does this respond to, or how does this relate to my situation? So I personally think it should be Melbourne that is contained, but that being said, I'm not the authority making the decision, and I welcome swift, effective decision making because we need to make sure we contain what could be something of catastrophic outcome for Australia. And it's very important that we all work together to make sure that quarantining is effective right across Australia, that testing is effective, and testing has been very good mostly here in Victoria, but I'm concerned about the tracing aspect and whether the tracing as good as it could be, and we need to put more resources into tracing, and then also ensuring that Australians are getting a very consistent message about physical distancing. When we mean 10 people can't meet, we don't say, well, it's okay for 10,000 people to meet. We need to make sure we're consistent in our messaging across all forms of interaction, that physical distancing is an important part of our armamentarium to keep all Australians safe.